When the American Civil War began, the state of medical knowledge was, to put it mildly, very, very primitive. Doctors knew nothing about infections and antiseptics. Antibiotics were not discovered for almost another century, and attempts to perform surgeries in sterile conditions did not even exist. However, after the first battle, when inadequately prepared and almost non-existent field hospitals were overwhelmed with casualties in a catastrophic state, it became clear that something needed to be done about it. Thus, wartime medicine during this war, brutally forced to adapt, would see significant progress. In this video, we will reveal the state of medicine during the Civil War, the drastic changes it underwent, some of the terrible mistakes made by medical workers, and the suffering and horrors experienced by the poor wounded soldiers, many of whom were brutally altered for the rest of their lives. The American Civil War alone claimed more lives than all the other wars America fought combined, and even the number of deaths from diseases was twice as high as the casualties in direct battle, when thousands of strangers from different regions gathered in tight and terribly dirty camps at the start of the war. Various infectious diseases flared up. Diarrhea and dysentery were extremely common and significant causes of death, accompanied by other diseases such as measles, smallpox, malaria, pneumonia, etc. The food was terrible, often spoiled and inadequately stored, also contributing to the spread of diseases. And that's all without any fighting. Then came the battle, and a new horror was immediately seen. The deadly combination of advanced weaponry and outdated techniques would be responsible for a devastating number of casualties. To better understand, unlike the unreliable and inaccurate muskets with round-ball ammunition, newer rifles with rifled barrels, greater range, new ammunition, and significantly improved accuracy were developed. When these technological advancements in weaponry were paired with old Napoleonic tactics, where large groups of soldiers in dense formations advanced towards each other to increase firepower and compensate for the inaccuracy of muskets using large fire volleys, it created a real massacre in the tightly packed lines of soldiers. Besides being extremely precise at a greater distance, and with the old tactics not changing for a long time, the new ammunition, the mini ball, was responsible for some of the worst injuries seen to date. As the mini ball was hollow and made of soft lead, when it hit a soldier's body, the bullet would expand and deform, transferring all its kinetic energy into the unfortunate soldier's body and creating wounds that were impossible to treat. The bullet would shatter the bone above and below the point of impact, grind tissue, and generally remain in the body. And due to its relatively slow muzzle velocity, it would pull clothing and other foreign matter into the wound. For this reason, 3 out of 4 surgeries during this war were amputations, as there was literally nothing else to be done except to completely sever the affected part of the body. Let's start from the moment of being wounded in battle. The most common injury was being shot by enemy fire. At the beginning of the war, stretcher bearers, many of whom were civilians, were tasked with picking up the wounded. However, they would flee as soon as the fighting started, as happened in the Battle of Bull Run, when the civilians responsible for the transport and evacuation of the wounded completely fled, leaving injured soldiers to lie in agony for days in the rain on the battlefield. Some even stole from the ambulance wagons and wounded soldiers, or outright refused to evacuate the injured. Therefore, the wounded primarily relied on their comrades to help and remove them from the battlefield, which took many soldiers away from the fight. Later, this evolved into a more organized medical corps. Stretcher bearers would evacuate the wounded to temporary battlefield hospitals, usually under tents and out of artillery range, and later they would be transported by train or boat to larger hospitals, which did not exist at the start of the war. However, after arriving at the improvised hospitals, the real horror for many wounded soldiers would just begin. First, there was no understanding of infection. and hospitals were breeding grounds for disease and filth. Sterilization or any hygienic measures were not used, and doctors did not wash their hands or instruments between patients. They often operated dirty, wearing blood-stained aprons and using dirty instruments. Doctors would even probe wounds with dirty, already bloodied fingers, and using filthy knives instead of scalpels was not uncommon. As you can imagine, infections were horribly common, and these conditions would even create what was known as hospital gangrene, a form of necrotizing fasciitis from which half of the soldiers who contracted it would die. Ether and chloroform were most commonly used as anesthesia, but they were fairly light and often led to the perception that they were not used at all. Being properly anesthetized was a luxury, especially for the Confederates, who were constantly plagued by blockades and shortages. Thus, some surgeries and amputations were performed live, on wooden improvised tables or unhinged doors, with little alcohol to dull the pain or something to bite on. Although soldiers generally received some form of sedation before surgery, finding the right and adequate dose was extremely difficult. The poor soldiers experienced shock, massive blood loss, and certainly lifelong trauma if they survived. An amputation would be performed in between 2 and 10 minutes. The limb would be amputated above the wound, saving a flap of skin which would be stitched to cover the wound, leaving the soldier with stub limbs. There were 2 types of amputations, primary and secondary. Primary would be within 24 to 48 hours after the injury, and secondary after a longer time, usually caused by an infection of the wound. There were also 2 main methods of amputation: the flap and circular methods. The flap method was mainly used when the amputation had to be done quickly. The bone would be cut above the flaps of skin and muscle, which would later be joined together to close the wound. This method often led to gangrene because deep muscle tissue suffered from a lack of circulation. The circular method involved a circular cut that allowed a flap of surface skin to cover the wound. Post-operative wound infections were a serious problem, often resulting in thick and creamy laudable pus. There is a saying that the American Civil War was the first modern war in terms of technology and the lethality of weaponry, which was simultaneously fought at the very end of the medical Middle Ages. Due to the shortage of time, manpower, and resources, not every soldier could be saved, and thus difficult decisions often had to be made. The Civil War saw the use of triage to distribute the wounded most efficiently and quickly into 3 categories based on their injuries. The first category included those whose lives could be saved, but only if immediate action was taken. Following them were soldiers who required help but whose lives were not immediately at risk and could wait a little longer. The third, tragically, were those beyond help. Any attempt to save them would consume time and resources, likely without success, costing other wounded soldiers with better chances of survival their lives. Thus, the wounded in this category were simply left to die without treatment, except for potentially making their final moments more comfortable. This group mainly consisted of soldiers shot in the stomach, head, or chest areas, and such wounds were rarely even attempted to be treated. After battles, hospitals would be overwhelmed with the wounded, and the few doctors available would work for hours, even days, without rest. Amputated arms and legs, along with the bodies of the dead who could not be buried in the chaos and haste, would quickly pile up outside hospitals. In the summer heat, the horrifying smell and sight would surround the field hospitals. Can you even imagine this? Despite all the horrors, about 75% of soldiers survived amputation, although the 1/4 who did not is still a high number. For those who survived, their lives were accompanied by the challenges of severe consequences from their injuries and missing limbs. Though fraught with challenges, the Civil War saw drastic advancements in medicine, forced by the devastating efficiency of new weapons combined with old military tactics. Consequently, future conflicts would see a significantly better organized approach to caring for the wounded, and medicine would experience substantial growth in the number of doctors, scientists, new discoveries, and the quality of treatment for both military personnel and civilians. It is interesting how some of the greatest horrors force us to advance, and based on the suffering of some, we have significantly better treatment for others as a result. We should be grateful to our ancestors for everything we have today.